All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions that we've received through today, the 9th of September. And we continue to invite you to submit your questions to us via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Vinay Derbakula, an intern this summer with the Institute. And Vinay, I turn it over to you.
Amazing. Thank you, Kristen. So we'll start today, as we always do, with some updated COVID statistics for the state of Illinois as well as around the country. In terms of the country itself, we're actually seeing a net decrease in the per day positivity rate, where on Tuesday, we were looking at about 160,000 cases per day within that week. Today, we're looking at about 152,000 cases per day. And so obviously, there's a short timetable in which that decrease occurred, but it does indicate that there is a trend where we might be potentially passing that high peak point. We might be breaking it. And then looking at the positivity rate for the state of Illinois, the positivity rate per day has also decreased, where it was 4,500 on Tuesday. It's now 3,900. And so that is going to go in tandem with the fact that there is still a gradual increase in the amount of people that are getting vaccinated. This country is seeing 51.7% fully vaccinated. That's about a 0.3% increase in the last 2 days, which is actually a pretty high number. But in general, more and more people continue to get vaccinated, and more people continue to see a decrease in the amount of COVID cases. Comparing the state of Illinois to other states, we look at Florida, which has about 16,300, and Texas, which has about 15,100. And while these numbers are way higher than Illinois, both of these states have also seen significant decreases in their per day positivity average. So all in all, we're looking at a lot of good news in terms of the number of cases that are occurring around the country. Then, in terms of some brief headlines, we're looking at a lot of different vaccines around the world, looking in the testing process being developed. India is working on a DNA vaccine, but the biggest thing is that Novavax is actually working on a dual flu and COVID vaccine. Dr. Murphy, do you mind talking a little bit about what this vaccine could mean for appointments and efficiency in the future?
Yeah, well, you talked about two vaccines. One is the DNA vaccine that is being studied in India and elsewhere. And it's an interesting vaccine. It would be the first DNA vaccine. It's not an injection really, but it's applied through the skin. And their preliminary results look fairly reasonable for this vaccine. So this opens up a whole new avenue in vaccine development. So it remains to be seen. You know, it's being studied now, and we'll see if it keeps people out of the hospital and keep them from dying like the other vaccines. The Novavax vaccine, which is not yet approved in the US, but should be very shortly, they also have a flu vaccine, so they're combining those so that you can take both the flu and the COVID at the same time. Kind of like we give measles, mumps, rubella all together, we can give COVID and flu together, particularly as in flu season. So very interesting development going with both of those. Because and on August 4th, you may remember that the CDC changed their guidance in terms of delivering vaccines, that you don't have to wait any longer, any period of time to get any other vaccine and COVID vaccine. You just get all your vaccines together if you want to. You can spread them out if you want, but you can take them all together.
Right. And then I guess going off that note, in terms of vaccine approval and stuff, we've talked a lot about this booster shot going back and forth. Now, yesterday, Maryland actually went forward with it. They kind of made an official statement saying booster shots are going to be available to all older adults living in nursing homes and other group settings, even though the federal government has not issued formal rules. And so do you think this might be a little trend, or is it kind of just all over the place? No one knows what's going on.
Well, what people are doing is talking with their feet. They're just doing it if they want to do it. I know many people who have walked into pharmacies and just gotten their third shot or booster shot or whatever you want to call it. What they're doing in Maryland is they've selected out the highest risk people, the ones that really are vulnerable. So it's different from just everybody can get a shot. It's really directed towards that very vulnerable group. People are, you're going to wait for yet another committee to meet to give approval when all the data pretty much has been out there. Other countries are doing this already. They've examined the data just as well. And so why wait for technical administrative approval, which is what this looks like it's going to be, and just go for it. And that's what people are doing. And that's what the state of Maryland is doing and many other places around the world.
Yeah. And then moving towards back to school numbers, we had talked about how cases were going up. And so obviously it's a little concerning, but we finally got the numbers back yesterday. And in the last week alone, nearly 252,000 children in the United States have tested positive. And so our back to school experiment is not working too well, unfortunately. And more kids are getting cases, and it's just going to continue to increase at that rapid pace. But the good news is that there was an article published a couple days ago that also indicated that while there are a significant number of pediatric cases, the probability of someone who is vaccinated getting COVID is about 1 in 5,000 or potentially 1 in 10,000. So that's 0.2% or 0.02% or 0.01%. And so that is actually some pretty promising data that should make a lot of people feel a lot better about the vaccination. Do you have any thoughts on either of these statistics?
Well, the back to school thing has been, unfortunately, a failure. 252,000 cases in the first 2 weeks of school it just shows it's not working. But it looks like people are just willing to live with those numbers. And this is just going to continue until the whole number of cases, like you mentioned at the beginning of the presentation, continues to drop. And then those school numbers will also begin to go down. The other thing that will happen is at some point in the next few months, approval in the 5 to 11-year group will most likely happen. That's going to lower things even more in the schools. So it's really, it's just unfortunate. But again, the point is everybody around those kids, if they're vaccinated, that will slow that process down. And the big news that you mentioned, the 1 in 5,000, 1 in 10,000 risk, those are real numbers. And so if you put it in really a big perspective, if you're vaccinated, the risk is really, really low that you're going to get infected.
Yeah, that's awesome news.
Vaccinated, right.
And then, yeah, those numbers are pretty compelling to me.
Yep, everyone.
And then in terms of Chicago, I think just for all the Chicago listeners, is there any headlines of note that we should be taking into consideration?
Well, Chicago's doing a pretty good job with the vaccination and keeping up with the numbers and everything. The travel advisory, because now virtually every state is a travel advisory, and we are a travel advisory to everybody else. So, the whole advisory, the whole country is a travel advisory. So actually that's not going to help. That just means if you're moving around a lot, you should frequently test yourself, which you can. You can walk into a pharmacy and buy a test yourself, or you can walk in and get tested at a clinic or whatever. That's what this is all about. The advisory thing has lost any kind of, unfortunately, usefulness just because there's just so much everywhere.
Yeah. And then, now we can move on to the viewer asked questions part of the segment. And so we'll start with a patient is wondering if they've received the Sinovac COVID vaccine second dose in May. Can they get Pfizer as a booster? And this is an 81-year-old female.
Yeah, so Sinovac we don't even have in the United States. So there's no way they can take another Sinovac vaccine here. So if they're here, the recommendation is if you're going to get a third shot or a booster, whenever these things formally get approved, or you're just going to go do it, this 81-year-old, you take an mRNA vaccine, and they can use the Pfizer as a booster.
Awesome. And then our next question is regarding monoclonal antibodies, which you had briefly mentioned in the past. And I think several people were looking for a bit more clarification as to A, what you mean by monoclonal antibody treatment, B, who may be eligible for this treatment, and then I guess C, or we'll get to the next part of the question after those first two.
Yeah, okay. So the monoclonal antibodies basically deliver manufactured antibodies, just like you would make after you got COVID or you got the vaccine, in a concentrated form, and you get it intravenously over half an hour, half an hour or so. And it's very well tolerated, and it really works. It just it's just loading your body with all these antibodies instead of waiting for you to make them. Because of that, it was shown early on that it only really works if you give it early. And if you wait too long and your body's already made the antibodies, giving them more antibodies doesn't help. So you got to take it early. So it's approved for anybody at risk, at high risk. And there's a whole list of people at high risk: age, underlying cardiovascular disease, immunocompromised status of any kind, asthma. It's very clearly outlined. The problem is you've got to very quickly get into a hospital or a clinic where they can give the infusion. So that's really the trick. In Florida, because they're not mitigating any other way, they actually set up these monoclonal antibody clinics. I commend them for that. But most hospitals, especially the big chain hospitals, do have the antibodies available. And I think you can just, you should, if you're infected, your doctor can send you there, or you can actually just go there if you're positive. You may want to call first to make sure that they have them available, and that you can just walk in to the emergency room or where they direct you and just get it. It's for a hospital, it's a pretty simple procedure. Right. It's, I think, about a half hour for the infusion, then you wait around for an hour after that. The doses, although you have to pay for the visit, in most cases, the medicine itself has been pre-purchased by the US government.
Perfect. And that actually ties perfectly into the next part of the question, which is just regarding, does that include AMITA hospitals as well? Just because I think there was some confusion.
Yeah, we had a specific question there, and we looked it up. The AMITA Health St. Joseph Medical Center in Joliet, supposedly they have all this available, and you should contact the hospital directly.
Okay. And then the last part of the question is just, some people had heard that there is a 92-hour deadline to receive these antibodies. Do you might know?
I don't think it's 92 hours. I think it's a little longer than that, but you do have to take it early. If you wait too long, it's not going to be effective, because you'll have your own antibodies already.
Got it. Awesome. And then we can move on to the next question. And so this is actually a really interesting question. So obviously a lot of people are getting vaccinated, but those that are not getting vaccinated, but also just everyone in general seems to be there's a lot of positive cases. And so some people were wondering, even if not everyone, we don't get to that 60% vaccination rate that would say, quote unquote, herd immunity, if more and more people are getting positives and then getting those antibodies, will that potentially lead to herd immunity regardless?
Yeah, it will. And this is actually what will happen in the world as everybody either gets vaccinated or they get infected, and the amount of antibodies in people has to increase. Now, we know that if you just get infected, particularly if you have mild disease, you don't have that many antibodies, and your antibodies tend to go down quickly. With the vaccine, maybe they start waning a little bit at 8 months. It really is amazing now how many people have at least some antibody present, either from the infection or from the vaccine. So all this is going to help, but you get more of the antibodies in a very consistent antibody level from the vaccine. So even if you've had COVID, the vaccine helps you. Matter of fact, it's kind of like COVID gave you a little first dose, and then you get like a much better response with the actual vaccine process. So don't sit back and feel comfortable just because you had COVID, because there's a way more breakthroughs in people who had COVID than people who had the vaccine.
And extraordinarily, the numbers have come back, and it appears that almost 94% of adults now have antibodies, regardless whether it's COVID or through infection. And so, well, obviously, you mentioned that the infection antibodies may not be as strong just because lack of symptoms or maybe even asymptomatic. A lot of people are really getting these antibodies, and so we're getting close. We really are.
Vinay, because antibodies are not the whole story.
Yeah.
But they're at least a good marker that's easy to measure.
Right. And then our next question builds off on the idea of antibodies. And so some people were wondering, with our memory B cells, do we really need like this booster, or what is the booster's purpose here if we have these memory cells that can just replicate the antibodies?
Well, you need a certain amount of stimulation, immunologic stimulation, to get the protection. And there's an optimal schedule for all vaccines that are given. Whether it's 1 dose, 2 doses, 3 doses, or boosters every 5 years or whatever, you have to keep stimulating all the parts of the immune system, including these B cells. So it's just, you got to get the optimal strategic regimen.
Got it. Yep.
That's the booster thing, or third dose, whatever you want to call it. That's what it's all about. Got it.
And then the last question is just regarding families that have vaccinated people and unvaccinated people. Obviously, the vaccine hasn't been approved for children under the age of 12. And so people are just concerned how fully vaccinated parents are faring in terms of protecting their kids when they're going out to work every single day and potentially bringing something back.
Let's look at a family unit. Say there's 3 kids and 2 parents. That's 5. Say one of the kids is 12, so that kid has gotten vaccinated. So you have 3 people in the family that are vaccinated and protected, have a lot less problems, and then you have the 2 kids. So the more people that have antibodies and protection, more people in the unit that are vaccinated, the less chance of having the infection and breakthrough infections happen. So it just highlights the importance that everyone in the family unit that can get a vaccine gets the vaccine, and that will decrease that family unit risk for getting infected and for getting sick.
Yeah. Well, that's all we have for questions today. Thank you so much, Dr. Murphy, for all your help.
Well, they're good questions. Thank you.